This is the NEU's weekly report on COVID in schools following the wider opening on the 8th of March. This week we'll look in particular at cases in Bolton and other hotspots and some NHS options for mass testing. Now, when we look at the ONS survey, this is the random survey, it continues to be fairly flat, and that's good news. But later on PCRs, we do see that an increase is happening. The ONS survey, though, is still flat across all nations, across all regions. However, you can see an increase in school age, more sharply in secondary ages. When we add on all ages to compare, you can see that for all ages, that's the black line, about 1 in 1,000 people have got the virus, the same rate as at the 7th of September last year. For primary age, that's age 2 to school year 6, it's 1 in 450 children have got the virus, that's the same as the 15th of September. And for secondary, year 7 to year 11, it's 1 in 310 students have got the virus, the same rate as the 21st of September last year. Those previous slides were all about the ONS, the random sample. That is regarded as being the most accurate, but with some uncertainties on it. This is looking at PCRs, so people who actually have a test. So if you test more, you might get more cases, but this is showing an increase in the number of positive tests since about the 3rd of May, and the rate of increase seems to be around the same as it was in July, August last year. Now that's much lower than the rate of increase in March 2020 when virus was doubling every 3 days. So it's a lower rate of increase, but an increase is not the direction we want to be going in. When we look at the cases in the hotspots, then the blue line for Blackburn and Darwin, you can see that increasing sharply. The red line overtaking many other areas is Rossendale in Lancashire and showing a sharp increase. The good news on this chart, though, is the yellow line for Bolton, much higher than the others, does seem to have turned downwards in recent days. Let's hope that's the effect of the surge testing and the surge vaccination going on, and let's hope we see that effect in the other areas next week. Now, the government in the hotspot areas is making surge testing available. They are encouraging every adult, every secondary child to test and to test regularly to find cases, asymptomatic cases, and they are producing resources for schools on this, which have been sent out today. So this slide shows that they are talking about targeted case finding testing. So that's doing a lot of testing in a particular environment to target and find cases. And they say on here specifically including schools and colleges. And today they've sent materials to local authorities that contain information packs which have sample letters for schools, Q&A and details of wider campaigns to support schools in encouraging testing for children in their schools. Now, we think the government should be supporting schools and asking schools in the secondary schools in the surge areas to test every child in the week after half term so that we can find those asymptomatic cases and ask those children to stay at home, thereby hopefully meaning that far less children have to do isolation in the coming weeks. We can see we need to do this because lateral flow tests were very high on the 8th of March, but have gone down quite a lot. So we do need to encourage the lateral flow testing to happen. While there's some concern in the previous slides, the hospitalisation still continues to be very good news, very low compared with other stages of the pandemic. On our log graph, we can see that it has started to increase slightly from a low base, but it is going in that wrong direction. So we have to do everything we can to keep cases under control. You see the same thing with deaths, down at a very low rate compared with other stages in the pandemic. Obviously, every death is a tragedy, but they are at lower rates. But even on the log graph here, we do see that decline in deaths has stopped. So all of us need to do everything we can to control cases. Hospitalizations and deaths are one effect of the pandemic. Another is on pupil attendance. And attendance last week has seen attendance decline slightly in secondary schools, now down to 87%. Normally it would be 95%, but last week it was 90, now declining slightly down to 97. Outbreaks in schools continue to be fairly low, about the same last week as the week before. 22 in primary schools, that's 1 in every 800. 30 in secondary schools, that's 1 in 140. There weren't any outbreaks reported in special schools last week. But we can see increases in the number of children who are off because of COVID. So 4,000 children were off because they had a positive test. That's up 1,000 on the week before. 18,000 were off because they had a suspected case, symptoms but no test, and that's up 1,000 on the week before. And 82,000 were off because they were self-isolating because they were a contact, and that was up 15,000 on the week before. 1,300 were off because their school was closed. And we can see that since Easter, the number of children who are self-isolating due to COVID has started to increase again, but it's nothing like the rate of increase that there was after schools went back on the 8th of March. So the general decline in cases has meant that less children are having to self-isolate. The real worry, well, one of the real worries with the spread of the Indian variant is that more children will be isolating again. And so for that reason, we want to keep mitigations in place. We want to keep masks until the trends are clear, until the vaccine is more widely spread. We want to encourage people to do the lateral flow tests. Ventilation does really matter. In-person staff meetings, in-person parents' evenings should not be happening, and we should protect the vulnerable. The NEU is continuing to maintain its school COVID map. You can check the rate around your school, so have a look if you're in Bolton, Blackburn with Darwin, etc. And our website continues to have health and safety and education advice. Thanks for watching. Please share. Thanks for being a member of the Union.